Hi, I'm Dr. Adam Tibble. I'm a cardiac anesthesiologist. As part of my training and part of my career, I was a critical care air transport physician for the United States Air Force. It's a fancy way of saying I was a doctor in charge of a team, and we transported our wounded soldiers on planes within Afghanistan and sometimes on to Germany. As an anesthesiologist, I was very familiar with the utilization of ketamine, but I didn't really use it a ton in my practice until I was in Afghanistan transporting these wounded soldiers. I distinctly remember a particular GSW or gunshot wound. He was in tremendous pain because of the thoracic cavities, just tons of nerve endings there, and it hurts. And had to transport him on a very rumbly, large C-130 plane. And in order to control his pain, I dosed him with a fair amount of ketamine. And that amount of analgesia that ketamine supplies allowed him to get through that plane trip. But what I also noticed is that there was something else, a calmness to this patient, to this soldier. And there was clearly something else that happened during this patient transport that I hadn't fully wrapped my head around yet. And then fast forward to getting out of the military, and it was around 2016. And in the mid-2010s, a lot of literature started coming out about ketamine's efficacy in the treatment of mental health disorders, treatment-resistant depression, anxiety, PTSD, all of these things. And at that time, I started a clinic. I started a clinic by myself, probably one of the early physicians in the United States starting a clinic. It was a very sterile surgery center environment. There were bright lights, there was an operating room environment, and put an IV in, put the medication in. And mirroring the studies at that time, there was still a 60% efficacy, meaning about 60% of my patients, right, at my tiny little sterile clinic, were doing better. But something was missing. Something was a little bit off. How do we take that number and make it higher? And still, one of the big knocks on ketamine therapy or any sort of psychedelic therapy for these mental health disorders is the staying power, the lasting power to it, or the longevity to it. How do we increase that and make it not only 80, 90% efficacious for the short term, but also for the long term? And so what makes us different, or what have we now figured out? Since my early days at this sterile clinic, we figured out a comprehensive care model. That means, yes, we give you the intravenous ketamine, but we also supply intravenous nutrients, which includes intravenous vitamins, NAD, glutathione, other medications. We also provide psychedelic guides for your infusion experience to hold space for patients, help people feel safe during their journeys. We also offer, if needed, ketamine-assisted psychotherapy. And then also, perhaps most importantly, as it relates to the longevity of the efficacy of the treatment, is we provide integration coaching. Integration coaching is someone that helps patients process these journeys so that they can take their experiences and use it as a springboard to becoming the person that they want to become. And so that comprehensive care is an integrative care that focuses on the patient's brain health, the patient's physical health or their body, right? And then also, especially with the coaching, creating behavioral change that results in lasting improvement. And so what do we have here? We've got a team of experts. We've got anesthesiologists, we've got nurse anesthetists, we've got psychedelic guides, we've got life coaches, we've got therapists. Just an awesome team that stands here ready to support you. Get in touch with us, and we'd love to help you at CIT Clinics.